Hello beautiful people and welcome to my channel. If you are writing your Osce exam soon, then this video is absolutely for you. Before I start, I'd love to say this: do not take any station or skill for granted. Okay, make sure you are reading your marking criteria. Like, even though you're watching videos, you're watching those videos exactly with your marking criteria, because the marking criteria is how you will be marked for your Osce exam. And I said, do not take any station or skill for granted. Don't think the station is simple, or don't think the station is hard. Okay, make sure you are serious with all your stations, with all your skills, with all your professional values, and with all your evidence base. Now, one of us had issues with this oral care, yes, and I'll be doing this video just because of her. So guys, pay proper attention. Without wasting any of your time, let's get directly to the video. But before we do, guys, honestly speaking, I'm doing this video precisely at 1:13 a.m. in the morning, but that's because I'm so excited. Just today alone, sorry, yesterday, I got over 22 messages. Nosv, thanks for your help. I passed my Osce exam. It makes me so excited, and it gives me like the passion, and it gives me like the drive to want to do more, because obviously it's working, you get. So I'm so proud of you all who has passed your Osce exam. Like I keep saying, nurses are brilliant and Osce is simple. So soonest we'll have you all band 7s, band 8s, and if God tarries, band 9. I'm really proud of you all. Now, if you're writing your Osce exam soon, trust me, Osce is simple. You are definitely passing in first attempt. Now guys, without wasting any of your time, let's get to the video.
Ryan Little.
Alright guys, so welcome back to my channel. So my name is Violet Okolocha. Do me a favor, like this video right now so you don't forget. Share this video with all your friends who you know will be writing their Osce exam soon. And of course, don't forget to subscribe. Now, oral care plan in your Osce exam is a silent writing station, and you have a whooping 8 minutes to complete the station. A lot of my online students who had the station in their Osce exam have said to me, Nosvi, will finished in 5 minutes. So 8 minutes is really much. 5 minutes should do, but it's a complete 8 minutes. It's a silent writing station. Now, so you are going to get a cue card. When I mean a cue card, you are going to be getting something like a scenario that lets you know that you are going to be doing oral care. So oral care has 4 scenarios. We have the learning and disability, we have the critical care, and the rest of them. But today we will be talking about the critical care. All right, we'll be talking about the critical care. Now, so you will get a cue card. In that cue card, the cue card could be like a scenario. For instance, Mrs. Ellie Brooke has now been transferred to the intensive care unit due to more complicated issues surrounding her health. She's now sedated and has an endotracheal tube in place connected to a ventilator. So once you hear ventilator, you know you are dealing with what? You are dealing with critical care. Ventilator, endotracheal tube, you know you are dealing with critical care. That's on one hand. You could also get like a picture. You know, you could get like a cue card with a picture of somebody with an endotracheal, with a ventilator, or connected to something like an endotracheal tube. Do you understand? So I've showed it on the screen, and I've showed you something like the scenario. So this is how it comes. Now, if you've watched my video on Bowen assessment, you can see for Bowen assessment, you get a picture. So, but for oral care plan, you could get a scenario, which will be like a cue card that tells you exactly about the patient, or you could get like a picture in the scenario where the patient is connected to like a ventilator or an endotracheal tube. So you would definitely know that you are dealing with what? Critical care. And once you finish reading your scenario, and you have to write your answers. So now you get like a piece of paper. Look at the paper, I'm sharing it on the screen. Oral care plan, candidate documentation, and you are going to be giving your responses in bullet points. Now guys, let's take a scenario, and this is my formulated scenario. I'll be giving you the 2 ways it could come in your Osce exam. Now this is it. Ellie Brooke has been transferred for Ellie Brooke has been transferred to the intensive care unit due to complicated issues surrounding her health. She's now in the ICU unit. She has been sedated and an endotracheal tube is in place, which is connected to a ventilator. You are the nurse in charge of Ellie Brooke. Kindly write a care plan on how to provide adequate oral care to patients based on this scenario. This is a silent writing station. Write clearly and legibly. You have 8 minutes to complete this station. So this is our scenario. Now on a second trial, like this is our scenario, you could also get something like a photograph like this on your scenario. Look at the photograph on your screen. Get a photograph like this, and you'll be told like the Ellie Brooke has now been transferred to the intensive unit for more intensive care. She's sedated and has an endotracheal tube in place connected to a ventilator. So whether you get a scenario without picture or you get like a picture with a scenario, it means the same thing. And now you are going to get this document which says candidate's name. What is the relevance of the relevant aspect of oral care that you will follow based on your scenario? So this document is just for you to write all your answers, and the answers to be written here are your marking criteria. Just make sure you use your own ways as long as it has the same meaning. So the marking criteria remains our standard. So my online students, one of them, Gudu, has formulated like an acronyms for this, which I'll be sharing. Well done to him, which I'll be sharing on this station. He formulated like an acronym for it, which I'll be sharing on the station. So for you to pass the station, you must write at least 6 points. If you write below 6 points, that's going to give you a fail, because for you to achieve a pass in this station, you must give at least 6 points. Now, so the acronyms for this is TAMO. The acronyms for this is TAMO. TAMURO. I'll share it on the screen just the way he wrote it. So now, T, the first T there means, twice daily cleaning of the teeth with a sunshine toothbrush. Tick. If you don't want to use sunshine toothbrush, you could use soft compacted headed toothbrush. So twice daily cleaning of the teeth with a soft compacted headed toothbrush. Don't say soft compacted headed toothbrush or sunshine, just use one. Twice daily cleaning of the teeth with a sunshine toothbrush, or twice daily cleaning of the teeth with a soft compacted headed toothbrush. Tick. Beautiful. Now the second T is twice daily cleaning of the teeth with chlorhexidine mouthwash. Twice daily cleaning of the teeth with chlorhexidine mouthwash to reduce the risk of ventilated associated pneumonia. Tick. Now the third letter there is A. Apply oral moisturizers to the oral mucosa and lip balm to the lip every 2 to 4 hours. Apply oral moisturizer to the oral mucosa and lip balm to the lip every 2 to 4 hours. Tick. And the next letter there is what? M. So minimize traumatic ulceration caused by endotracheal tube by using what? Design fasteners and bite block and alternating tube from side to side. It's not hard. Minimize traumatic ulceration caused by endotracheal tube by using what? design fasteners and bites, design fasteners and bites block, and alternating tube from side to side. The next letter is U. Use suctions to prevent aspiration when required. Use suctions to prevent aspiration when required. Tick. Beautiful. Well done. And the next one is regular reassessments. Regular reassessment of the mouth every 8 hours. Regular reassessment of the mouth every 8 hours, and that is going to give you a pass. Now guys, tell me what you think in the comment section. This is really simple. If you have any question or you have any skills you want me to do, drop it in the comment section. I'll be more than happy to talk about it. Now, if you have a receipt and you don't understand the reason for that receipt, make sure you discuss with your Osce tutors in your trust or in your care home. And if you don't have, book a class with me. It's not what's going to fail. I had somebody who sent me an email and she said she needed help, and I said, okay, that's fine, let's help you. And then she's failed the first time, failed the second time, and failed the third time. So I said to her, your portal will have to be closed for 6 months, because obviously I can't help you. I can only help you when you write your Osce exam and probably you have a receipt. Then you can book a class and we can discuss about your receipt. Or probably you want to take your Osce exam and you don't understand anything, you can book a class. You understand? I can't help you when you are failed obviously for 3 times. Okay, so it's so sad to see that people are still going through this. So if you don't understand anything, your best bet is to book a class and not to fail. Okay, failure is not your portion, your pass. Okay, and by the way, you could also be a channel member. The benefit of channel member is you supporting the channel, of course, and God bless you for that. And you are going to be accessing some videos that are not for everybody. So I have some Osce videos that are not accessible for everybody, so you could consider being a channel member if you want. Okay, all right guys, thank you so much for watching. I will see you in the part 2 of this oral care plan. Remember, you have to identify 6 points for you to pass. Until I see you again, keep passing your Osce exam. Bye guys.